This is Tom Biernacki, and today I'm going over the bunion surgery secrets, the best recovery time, the pre-op expectations, pre-op planning, the best procedures, and what you should be doing after your bunion surgery. And we're starting now. I've seen thousands of patients. I've done all of the procedures that I'm going to talk about here. I'm going to talk about what works, what doesn't work. Do you need surgery at all? Who should get surgery? We're going over all the recovery time tricks, the tips afterwards, and when you should not get bunion surgery. What is a bunion? A bunion needs a biomechanical exam because most people that come in with a bunion might not actually have a bunion. There's actually another condition called hallux rigidus. Hallux rigidus is arthritis of the big toe joint. This right here is the big toe joint. If it's arthritic and I can't bend it back and forth, that's arthritis. There's 4 grades of hallux rigidus. If it bends but kind of creeps, that might need a little bit of cleaning out. But if it's fused all the way and does not bend, then a clean out wouldn't really work. A bunion surgery wouldn't really work. That's when something like a fusion procedure might be needed. I talk about hallux rigidus and exactly how to take care of it. So if you can't bend your joint at all, check out my hallux rigidus videos and all the things you should be doing about that. A tailor's bunion is like a bunion of the 5th toe joint, so not the big toe joint, but right here. If the outside of your 5th toe hurts, that's a tailor's bunion. That's a little bit different than the bunion we're talking about. Check out our video on tailor's bunions, whether you need surgery, tips, tricks as well. What we're talking about is if you look at your big toe joint and it buckles out like this. So what happens is if your big toe joint's crossing or coming under the 2nd toe, if you have a hammer toe that's curling over the big toe joint, that's what we're talking about here today. So that's not necessarily arthritis. End stage arthritis could develop. So if you've had a bunion for like 10, 20 years, then you could develop arthritis, but that turns into more of an arthritic condition. More of a fusion might be what's needed for you. So I would consider that more of arthritis or hallux rigidus. So I'd check out that video below. In the classical sense, the bunion is the angle between these 2 bones right here, called your intermetatarsal angle, and your big toe joint right here. And this is called your hallux abductovalgus angle. You can also get this angle right here, which is called your hallux intraphalangeal angle. So that's a different story as well. And the new 3D bunions, that's this joint right here. This is called your first metatarsal intercuneiform joint. So this joint right here can be fused or worked on as well, not just your bunion right here. There's a lot of new treatments which address more joints, more plates, more screws by fusing more joints. Is that the answer? We'll talk about it. Bunions are associated with about 25% of the population between ages 18 and 65. Once you get over 65, up to 40% of people have bunions. It's way more common in women than men. And the answer is women wear nicer, pointier shoes with more of a heel that flattens your foot out more. And at the same time, women's ligaments in general are more flexible because they have hormones that help them deliver babies. The ligaments are more flexible, to open up the pelvic cavity to deliver the baby. That, in my opinion, is why women get bunions a little bit more frequently. So bunions, the real key for surgery is your bunion symptom, pain and discomfort. In my opinion, most patients that come to see me, if their only problem is pain and discomfort, 95% of the time you can get rid of that pain and discomfort by doing non-surgical treatment. So I have a lot of great videos, my top 13 bunion home remedies, my ultimate guide on bunion treatment in 2024 coming up. I go over all of it in detail, the pads, the splints, the injections, all the fancy contraptions. We review them all. We look at the studies and I tell you my real world experiences. Pain, I think you don't need surgery if pain is your problem. If you have redness and swelling, a lot of the times that is it rubbing against your shoe. Sometimes a splint, a gel pad, a proper orthotic, a proper shoe can make all the difference. I give my best shoe guide, my best orthotic guide, my 3D printed orthotics from home guide. All that kind of stuff can help depending on how much you need. But again, pain can usually get a lot better. And same thing, the limited range of motion. If you can't bend your big toe joint at all, it could be arthritis or maybe the toe's just dislocated. If you can put your foot flat and your toe doesn't bend up, maybe it's arthritis. If you have arthritis, then it's more likely you might need surgery because as you develop more arthritis or more permanent damage, that's when surgery is much more necessary. Recent studies on bunions. The causes are genetic factors. If your mom or dad had it, you're much more likely to have it, according to the Journal of Foot and Ankle Research in 2019. Shoe selection. So people who wear pointy, high-heeled shoes are more likely to have it. What determines a bunion? It's hard to say. A lot of these studies use questionnaires, look at large numbers. What most people think is a bunion is not really a bunion. It's tight shoes rubbing the big toe joint, could be arthritis, could be severe flat foot where the inside of the foot is receiving pressure from your body weight, or severe obesity, which is putting pressure on the big toe joint. Bunion surgery will not fix the vast majority of these problems. Bunion surgery will straighten the toe, but they will not fix all the other factors I mentioned. Shoe selection. Do barefoot shoes work specifically? This is the hot topic. For a lot of people, barefoot shoes can work because they take pressure off the big toe joint and the pain goes away. And because you're barefoot walking, you take shorter, choppier steps and your foot does not flatten out as much. Thus, your big toe joint does not get as achy. I would not recommend barefoot shoes to the vast majority of my patients for this reason. If you broke your ankle, does walking barefoot sound like a good idea, or should you be in a supportive cast until it feels better? Everybody knows you're not going to walk around barefoot, even though barefoot walking would strengthen your joint. Now that's an extreme example, but a bunion is an injury. If a bone is dislocated, would barefoot walking strengthen the muscles and pop it back into place? I see a lot of these videos, and that only works for young, healthy people, which coincidentally is who's making these videos. Like I see 20-year-old, good looking, great shape fitness influencers talking about how they cured their bunion by barefoot walking. But my audience is usually older people with severe health issues, tight knees, tight hips, tight back. Listen, a 20-year-old influencer, they don't really have a true bunion injury. They have a non-arthritic, irritated joint. That's it. By walking straight and getting pressure off of it, that's usually why they heal. And yes, barefoot walking gives you more proprioception, which means you sense that you're walking a little bit better. And while that is true, but if you have one knee collapsing, one hip bent, if you have a pulled, scarred hamstring, if you have really tight calves that need years of stretching to get straight, you need a supportive shoe. You need a supportive orthotic. And the vast majority, I would say like 75+% of patients are bad candidates for barefoot walking, and it will make their foot pain worse. That's my personal opinion because it's hard to look at all these studies. I've had so many patients that have tried barefoot shoes and it just like destroys their body almost immediately because they have more advanced biomechanical injuries. And I would tell you the vast majority of older, non-20-year-old, non-30-year-old people that watch these videos do have joint problems and stiffness that cannot be overcome by just barefoot walking. If you stretch those joints, if you get your muscle strength up, if you're weightlifting every day and you have no arthritis, you can eventually barefoot walk again and do it very healthy. That's the goal of these videos, is to get people back to that condition. And in my opinion, it is possible. Conservative treatments, for that reason, can be effective for lesser types of bunions because you're not rubbing those toe joints. You're wearing now the proper shoes, the proper orthotics. Most of my patients, once they get through this step, they do not need surgery, but we're focusing on surgery today. Check out those videos below. We're talking about 3D bunions, minimally invasive bunions. We're talking about fusion surgeries, in-office procedures, bunionectomies, Chevron bunionectomies, Austin bunionectomies. I've personally done all of these. Here's the bunion surgery recovery time. On average, if you're making a bone cut, it takes 4 weeks for that bone to heal about 50%. It takes about 3 months for that bone to heal about 75%. It takes 6 months for that bone to heal 90%. And it takes 1 year to get close to 100% bone strength. That being said, you can walk on it much earlier. So I know there's some bunions that people can walk in 1 week, 2 weeks on the more minimally invasive end because you didn't cut all the way through the bone. But with the more severe fusions, things like that, it can take longer to heal these bones. Here's the recovery time. Immediately when you wake up after surgery, you're in the recovery room, we keep an eye on you, you're in a dressing. So your stitches are in place, you have a dressing or a cast. Usually you get some pain medication because it's painful the first day. You get a bandage, a dressing, and you don't have to change this. It stays in place, you keep weight off of it. Usually in 3 to 7 days, you come and check in with us, we check you again, and you're immobilized. You're either wearing a cast, a boot, a surgical shoe, you're using a knee scooter, some crutches, you're using a walker to get around, you're non-weight bearing, partially weight bearing, or full weight bearing, depending on the procedure. The more minimal the procedure and the more hardware, the more stable you are. The less hardware and the bigger the procedure, the more you got to keep weight off of it. When you go home at night, you'd elevate your foot, you'd put ice on it, you can take some anti-inflammatories, you can take some Tylenol if your doctor allows you. For incision care, you don't really have to do it. I would recommend not getting it wet. Medication-wise, you might need antibiotics in the 1% chance that you could develop an infection, but usually you don't need antibiotics. You need some pain medications. Your activities are restricted. Now, I know some people advertise that you can get moving quickly, but you're not going to be able to run a marathon. Bone healing is bone healing. No one is superhuman. It will take you 4 to 6 weeks to heal 50% of that bone, 6 weeks to 3 months to heal like 75% of that bone, and we're talking like 6 months to get to the 90% point. As a few weeks start going by, your stitches are usually out in about 2 weeks, you're getting x-rayed afterwards. That's when physical therapy makes sense. A physical therapist can show you how to move your big toe joint up and down. You can do some foot exercises, some clawing motions, bending your ankles up and down. Now, I have videos down below how to do that, my foot strengthening and exercise guide. That can be very helpful for you. For swelling management, after a couple of weeks, you might want compression socks, you might want a wrap that helps you, and follow up with your scheduled appointments. After a few months, so usually about 2 months, you can start moving with heavier duty activity. You can start going on long walks. What you still want is, at this point, and probably up until about 6 months, you don't want to walk around barefoot. You don't want to wear high heel shoes. You want a good supportive orthotic. You want good supportive shoes. You want a lot of cushion. You want to keep going with your physical therapy in months 2 to 3 or 4, somewhere in that range. You want to keep working on that. And you got to be patient. The biggest mistake I see, and the biggest reason I see patients angry, is everybody expects their foot to heal quicker than it does. And no matter which one of these surgeries you do, even from minimally invasive to more, like, yes, it's stable to walk on after a couple weeks, but that doesn't mean you're going to be pain-free running a marathon. It's impossible. This is false marketing in a lot of cases, and patients unfortunately become upset because they expect that. And for long-term follow-up, listen, if you're tight through your back, your hamstrings, your hips, and your calf muscles, you need a biomechanical exam to get yourself stretched out and walking correctly. Surgical option. Number one most common is the bunionectomy, or the silver procedure. What you're doing is you can shave down the bone. So if you have a spur, you can shave it down. The top of the big toe joint, you can shave down. This works great for mild to moderate bunions. You're not really making a bone cut, you're just kind of shaving it around. This can also be known as a chilectomy if there's a spur, or a silver bunionectomy. This does not correct the angle of the big toe joint. It does not realign the metatarsal phalangeal joint. The success rate is generally pretty high. Studies show about 85 to 95% because you're not recorrecting the entire bunion. And that's according to the American Orthopedic Foot and Ankle Society. I would recommend this if you just have a spur. It's a more minimal one, but in most cases, wearing the proper shoes, proper orthotics can help with a bunion like this. Doing both together leads to great improvement. Now, number 2 is an osteotomy. These are known as chevrons, revered in green, Austin procedures. This is for the moderate to severe bunions with a hallux abductovalgus ankle. You can get a lot of correction in this and straighten the big toe quite a bit. And this corrects the HAV angle, not necessarily the intermetatarsal angle. It can correct the metatarsal rotation in some cases, but not with the majority of these. The success rate is about 90%. So these have generally been very successful procedures. You use 2 screws, no plates. Patients have generally been very happy. The Journal of Foot and Ankle Surgery reports the Lapidus procedure, or the 3D bunion procedure. The osteotomy works on this bone right here. So this joint, I should say. It cuts this bone, shifts it over, sews the capsule a little bit straighter. The 3D bunionectomy works on this joint right here. And usually there's 2 plates that get put on the top, on the side. You can do 1 plate, you can do 1 long screw, you can do just screws. If you use just screws, you have to protect it a little bit more. Most procedures work on this joint right here. The 3D bunions work on this joint right here. So you could see by holding this straighter, it bends it in like this, whereas shifting this one like this can also bend it in. There's a lot of promotion now for the 3D bunionectomy. I like the procedure. I personally got away from it because it's much bigger surgery, a lot more hardware. If a patient doesn't need like a massive correction, they're gonna be pretty stiff through their midfoot, you know, because when you walk, your midfoot can't collapse. But now if you need more correction, that could be very helpful. Not every patient needs the 3D correction. And in fact, there's a lot of studies out there. They could be actually lower outcome. The 3D bunion or the Lapidus procedure, according to the Foot and Ankle International Journal, can show even slightly lower success rates. But that's not fair to that procedure because you're probably doing this procedure in the middle with a more severe bunion case. The bigger the surgery, a lot more can go wrong. I have a lot of patients come in with bunion surgeries that did not work or bunion problems. Over time, these are the ones that have more long-term issues, where if it works, it's great. If it doesn't work, then you got a lot of problems, unfortunately. Minimally invasive surgery is basically, you can do both of these types with minimally invasive, but minimally invasive means you're making a smaller incision. So it's a very vague term. Minimally invasive surgery is smaller surgeries without plates, without screws, that are done in the office. I personally like to do these a lot because if someone's wearing the proper shoes, proper orthotics, stretching, getting a proper biomechanical exam, you can do a very small procedure where you're not cutting the bones all the way through, but you're kind of readjusting the capsule, and that can heal much quicker and much easier than these larger procedures with a lot less downside. I've eased back from doing as much bunion surgeries. I don't do the big ones anymore. I used to do a lot of them. I just felt like by doing a proper biomechanical exam with the proper shoes, proper orthotics, proper insoles, my results were a lot better and it pretty much eliminates all the risk. I personally have gotten away from doing bunion surgery. I think our body was created really well and it has the capacity to heal. And I do have a video that goes over, can bunions be reversed without surgery? I think the vast majority of pain and deformity can. Now, if you have severe osteoarthritis or damage, then yes, surgery is needed. You won't be able to stretch that out. If you can bend your bunion back into position and move the toe up and down, then in my opinion, I try and talk people out of surgery. I don't think they need it. Whereas there are other offices where you're already filling out preoperative paperwork before you come in. Bunion surgery is not always needed unless it's very severe. The success rates for minimally invasive surgery, they can vary because you can do a lot of different procedures. They're kind of similar to the other ones. So you got to think the success rates of all these procedures are very similar. It's not like this new treatment is like twice as good. It's not. And the studies show that. If you look at horror stories and problems, all of these bunion procedures will show it. The real horror story is if a proper biomechanical exam is not done, if the blood flow is not great, if you really have hip, knee problems, flat foot problems, if you don't handle all of those problems first, then a bunion is not going to help you if it's done surgically. And that's where we come to number 5 procedure. This is a fusion. If you take this joint and if you rough it up in between and hold it together with a plate or a screw in the straightened position, that toe will never bend again. With really severe flat feet, with arthritis, the fusion is actually probably the most successful procedure. But would you do a fusion on a very small bunion without arthritis? No, because you won't be able to bend your toe joint again. People with arthritis, you don't bend that toe joint anyway. So a fusion is actually very effective. Now, flat foot reconstruction. Flat foot reconstruction might be needed with a more severe injury. Again, unless there's like a dislocation of the ankle or a collapse or severe arthritis through the midfoot, I don't really recommend these procedures. I think orthotics, bracing, and proper shoe gear can really get kids and adults into good position. Bunion recovery tips. Gel pads, splints, taping work extremely well. I put my guides on that below. Strengthening, stretching, calf, hamstring stretching. I've got great videos on that below. Those work extremely well. Pain management, make sure you ice, elevate, keep your foot up after your procedure. That's going to make a big difference. Keep that incision clean. Follow your surgeon's guide on weight bearing. It's very tempting to start walking early, but that can slow down your healing progress. Post-surgery footwear. Even though you've had surgery, you still want to wear good orthotics, good shoes, and get pressure off of it. There's a reason you formed a bunion. It's probably because of your biomechanics of your foot, your ankles, your knees. So you want to correct that as well. I'm a big fan of good supportive boots with a lot of cushion in them. I love scooters. I would anticipate on getting a scooter. I like walkers way more than crutches. I think people hurt themselves on crutches. Make sure you get physical therapy. They can address your calf tightness, hamstring tightness, hip tightness. That will actually help your bunion surgery recover. Compression stockings, they can keep your swelling down. You want to get enough sleep, you want to rest, and you want to be patient. The long-term outcome is way longer than you think. That's the one thing about bunion surgery. It's always longer than you think it's gonna be. If you want the best home remedies, yes, I do think for the vast majority of people, they can significantly improve your pain, and I do think they're worth trying before you try a more invasive surgery. Check out the guide on my top 13 remedies. They work in a lot of cases. If you have arthritis, you might need a procedure. If you have a severe dislocation, you might need a procedure. But check out the comments in these videos. There are people posting their testimonials, how they thought they needed surgery, but by wearing proper shoes, proper orthotics, their bunion pain went away. Their joint pain went away. I see this a lot with my patients, even though it's hard to point to studies because no one wants to pay for studies that take away from surgery patients and expensive hardware. But check out those guides down below. It'll help you a lot.